In this lecture, we are going to cover potential trauma responses. When we think about responses to traumatic events, our mind probably goes to fight or flight, right? Because these are typically what we think of. In fight or flight, your brain activates the sympathetic nervous system. Your heart rate increases, your body's trying to get blood to go to your muscles, your blood pressure goes up, your pupils dilate, right? Sometimes, hey, something which is very fun, but your body might decide to dump everything, right? So you might throw up, you might urinate involuntarily or defecate involuntarily, right? Your body's getting you ready to either engage in fighting, which is like physically fighting, struggling, yelling, screaming, right? That kind of thing. Or you're getting ready to run. Right? So flight, here this involves running, hiding, trying to put distance between yourself and the danger. And we've probably all had sort of near-miss accidents. Right? And after that near miss, you're all jangly and shaky. Right? Your breathing rate has picked up, your heart is kind of pounding out of your chest. Right? And that's a pretty fairly common experience. However, we now know through research that there are more responses to trauma and traumatic events. Through research, we now know that there are 3 additional responses to traumatic events. Right? You might freeze, you might flop, or people may potentially try to utilize persuasion strategies, what we might call friend, right, as a way of dealing with the event. Right? Because you can't always fight, and there's not always a way to escape. Right? Now, when you freeze, your body has activated the parasympathetic nervous system. Right? Your muscles get tight, and they freeze. You kind of go still, you're silent. And that doesn't mean that you want something bad to happen to you. Okay? We see this in animals all of the time, which is why there's a picture of a mouse up here, right? Mice will just freeze in one place. You see this in rabbits, right? They just kind of freeze. Right? This is a completely normal response. Flopping, right? When an individual flops, their muscles kind of go loose. It's an attempt by your body to reduce physical pain, and your mind shuts down. What happens is your heart rate drops, your respiratory rate drops, you might stop breathing, your metabolism goes way down, and your body releases endorphins. And you might not be aware of what's happening around you. And this often occurs during inescapable trauma. Friend is a strategy that people will sometimes attempt to use, right, during an assault that they're experiencing. So here you're trying to negotiate or placate the attacker. You're talking to them, telling them about yourself, trying to build up a rapport. This also does not mean that you are giving consent to an attack. It does not mean that you wanted to be attacked. Right? Frequently, people feel very ashamed of themselves when their body has engaged in the freeze or the flop, or they've tried to utilize the friend strategy, right? And they shouldn't be, right? This is your body's attempt to manage an unmanageable situation. But when people have these responses, often this complicates trauma because then they feel responsible and they feel implicated. And when they're talking to other people about this, other people might not be as sympathetic because they don't understand, right, how the body responds to trauma. So I'm just going to reiterate this again. Freezing, right, experiencing the flop response, or trying to utilize that friend strategy, these are absolutely your body's legitimate responses to trauma, and there is nothing for anybody to feel ashamed about if they've had this kind of trauma experience. Right? We see these kind of trauma experiences in people who've had years of training in the police or in the military, right? Who are used to high stress situations. Right? This is, your body picks a solution and it goes with it. So I just wanted to introduce trauma responses to you.